Welcome to the Lipoedema podcast, hosted by Shell and Tiana. Our aim is to make noise around lipedema and educate as many people as we can about this disease.
Our guest list contains professionals who work in the field and women who live with lipedema. Thank you for joining us.
Dr. Lucy is passionate about obesity medicine and helping people going from overweight and overwhelmed to in control and full of health. She was an expert yo-yo dieter and was completely and utterly addicted to sugar. She developed obesity, fatty liver, and pre-diabetes. She has completely abandoned traditional dieting and embraces a low-carb, real food lifestyle. She has lost 20 kilos and maintained this for over 3 years. Dr. Lucy graduated from medical school at Monash University in 1993. After having her own weight loss epiphany, she became a certified lifestyle medicine physician and a clinical hypnotherapist. She is a sought-after public speaker and has spoken at multiple medical conferences on the management of obesity and weight loss. Dr. Lucy runs a busy weight loss clinic in Melbourne and advises on a low-carb lifestyle. The clinic is booked out for months, and so she has transitioned to the online space. She, along with her colleague Dr. Mary Barson, have formed Real Life Medicine. They run successful online programs that address both the physiological and psychological causes of overweight and obesity. Dr. Lucy believes passionately in helping people untangle their relationship with food and has a wonderful knack for storytelling and using analogies to explain complicated medical and behavioural science.
Hello, Dr. Lucy. Thank you so much for joining us today.
Oh, you're welcome. It's a pleasure to be here and I'm honoured to be invited. Thank you.
Thank you. Now, I wanted to kick off because Shell and I have both been listening to Real Health and Weight Loss, the podcast that you co-host, and you have done quite a few episodes about lipedema, which we're very excited about. But you did mention in one of those episodes that you weren't taught about lipedema in med school, and you yourself do not live with lipedema. So I'm really curious to know from you, how did you come to learn of lipedema?
Well, the magical world of podcasting. So when I first learnt about the ketogenic diet and I was consuming all the amounts of information I could find, YouTubes and various keto podcasts, and there was one called Keto Woman with Daisy Brackenhall, which is she's a gorgeous English woman, and she was interviewing this lady who kept talking about her lipedema. And I'm thinking in my mind, oh, she means lymphedema. She's just got her words wrong. It's a big word. Okay, we'll just carry on. And she kept saying it. And in my head, I'm correcting her, lymphedema. And then she comes up with, some people will think I'm talking about lymphedema, but this is a separate condition. And I thought, what? What do you mean? So I thought, oh. So then I thought, well, I better go and find out about it. And so I did some Googling because that's how you find out about things. And then a number of patients came to see me, both, many of whom have got lipedema, which some knew about it and some didn't. And so I would just, interrogate them for information. How does this feel? What does it feel like? What are your main symptoms? Because I just wanted to kind of learn all I could about it from a person, from their lived experience. So, I learned that, there's often joint hypermobility in the joints. I learned about the pain. I learned about the little rice granules. I learned about vitamin D deficiency is common, all of those things. I just suddenly, as I said, I was just crazily, like a crazy woman, asking. So I could educate myself.
I can't tell you how refreshing it is to talk to a medical professional like yourself who is just, and I'm sure you're all very interested in learning, but when it comes to having those short, sharp 5 to 10 minute appointments with your GP, the amount of things that they have to know on the spot is quite insane. And so for them to take the time to be interested and do some research to be able to help their patients is just so refreshing. So that's so interesting. And you obviously work in the weight loss space. So you would have access to a bunch of women with presenting with this.
Yeah.
And I can just imagine the difference that you make to them just knowing about this condition.
Oh, well, I think it was like, it was the most eye-opening experience for me, because I first of all realized that there were people, before I knew about lipedema, there were women I was trying to help, and they had lipedema. I didn't know about it. They didn't know about it. And so it was like, and now, I look back and I think, God, if only I'd known earlier, I could have, I would have changed my approach. Although not completely, because my approach really still is based in a low carb / ketogenic diet, not necessarily keto, but that's still the mainstay of my approach. But the way I would have packaged up the messaging about it would have been different. And I would have talked to them a lot more about, I was just going to say, I would have talked a lot more about that your food can change your pain levels, that your food can reduce your inflammatory load. And then I would have been talking to them about going to get, see a good physio, get your compression, do all the things, other conservative things that you need to do to manage lipedema that I didn't know about. So, yeah, so I feel happy to have learnt about it.
Oh, that's really good. It's very great. A nice segue that you started talking about inflammation, because my next question specifically is about when you're talking to the lipedema community, a lot of us hear that we need to reduce our inflammation and manage our condition. And I'd really like to ask you, can you dig a little deeper for us about what exactly is inflammation?
Yeah, so inflammation is not a bad thing in general. It's part of the normal human immune response, and it's, there's lots of things that cause inflammation in our body. Infections will cause inflammation, injuries will cause inflammation, but inflammation is meant to be a short-lived, so short, sharp experience, a little bit like stress. It's fine, but it should be over. So there should be an endpoint. And what we know with lipedema is that, and lots of other inflammatory type of conditions, it's a chronic, so it's an ongoing. So I always explain the word chronic, and apologies to anybody who already knows what it is, but sometimes people think chronic means intense or big, and it's time, it's chronicity. So a long time means chronic. So you've got chronic inflammation, which it then sets up its own issues in itself. So we want to be able to reduce as much as possible the inflammatory load on the body for everybody, whether you've got lipedema or not, but particularly if you've got lipedema, because the underlying pathology, if you like, is an inflammatory process. So I'm sure lots of your listeners know, but you know that the vessels between the fat cells are leaky. They leak fluid into that interstitial space. So the interstitial space is just the tissue between cells. It's there. It's not meant to be there. The body's going, my God, what's this here? What's all this fluid doing here? It's not meant to be here. And so it makes an inflammatory response trying to push it back. And that makes it quite, forms this sort of jelly, which is why, it's painful. And then if left for long periods of time, it scars. And that's what causes the fibrosis or the little scars in it. And they can be from tiny little sandy pebbles to, grainy things, even up to walnut-sized lumps.
Okay, perfect. So thinking about inflammation being a really big pain point and focus area, how then, what's your professional approach to your patients with lipedema, and including inflammation and insulin resistance? So how do you tackle your patients?
Yeah, so I think it's important to elucidate that there are two conditions. So lipedema is one condition and insulin resistance is a separate condition. You can have them, you can have either, or you can have both. So if we focus first on the lipedema, so lipedema, as we know, is genetic predisposition. There's some environmental factors that usually trigger it, seemingly around hormones. Estrogen probably has a significant role, given that most women, their symptoms worsen during puberty, pregnancy, and then weirdly worsen during menopause when we actually reduce estrogen. So there's a little bit of a paradox going on there. But the things that we as humans are very good at doing is making our inflammation worse. So we can't change the cards we're dealt, but sometimes we play them pretty badly. So the things that we do that make inflammation worse are we don't sleep enough, we don't manage our stress, and we don't eat well. They would be the three biggest things that will cause inflammatory loads. In particular with the food, it's really that ultra-processed food is, it's highly inflammatory and causes a myriad of other health conditions, whether you have lipedema or not. So if we focus on the things that we can control, we can't change the genes, we can't change estrogen, what can we control? We can control the food that we eat. We can control going to bed on time. Most women are really hopeless at that. And largely it's because we're carrying this big cognitive load. We've got kids or we've got teenagers and we're busy and we're working and we've got elderly parents and everyone wants a piece of us. And then we get to the end of the day and we just want to sit on the couch and we just want to eat a bowl of ice cream and we don't want to go to bed. And it's like, but if we do perhaps forego the bowl of ice cream and go to bed, then it really does set us up for ongoing, good health, which makes good choices the next day. When we're not tired, we're not inflamed, we're way more likely to make better choices.
Yeah, I love that. And sorry, and I just wanted to touch when I mentioned inflammation in my initial question, what come to my mind is usually when you're talking about insulin resistance, you present with a sort of a bigger belly, but we find in lipedema patients that we actually have bigger limbs and our waist is usually quite small. So it's very different for us. So does that mean that even if we have a smaller waist and not much of a stomach, that we're still living with insulin?
Not necessarily, no. So insulin resistance is a sneaky little thing. So insulin resistance occurs when our pancreas, basically our insulin isn't working as well. So our pancreas has to make a lot more insulin to get the job done. So the insulin's job is to move glucose from the blood into the muscles. Loves doing that. It's great at it. And if we didn't do that, then we get very high glucose, and there's obviously problems with that, and including, the effects of type 2 diabetes. So high blood glucose is harmful, and our body doesn't want it to happen. So it will make lots of insulin to counteract that problem, which is great. Except insulin's side gig is fat storage, but it's usually abdominal fat storage and organ fat storage. So insulin resistance is its own issue. And interestingly, depending on what ethnicity you are, your fat storage will be different. So for usually Anglo-Saxon people, they will get a large belly before their insulin is really high. Whereas if you're Asian, even Indian, you're often still quite lean. So it's the tofu, that, have you heard of that? The thin on the outside, fat on the inside. So they present, walking down the street, you think, oh, they're sort of, whatever normal body weight is these days, but they're that. And then you find when you do your bloods and you go, actually, no, you've got all the signs of insulin resistance. You've got high insulin, you've got fatty liver, and so it's not necessarily completely related to size. So women with lipedema can just have lipedema where their fat stores are mainly arms and legs and bottom and hips. There are some women who do have lipedema on their abdomen, but it's much rarer and more common. Abdominal fat is more commonly insulin resistant, so people can have both.
Gotcha. Fantastic. So you are advocating for real food to really bring down that, and brings down both, right? The inflammation and the insulin resistance if we concentrate on real food. What does that look like?
Yeah. So there's a couple of things that are what I call your more inflammatory foods. So there's really three. So the sugar. sadly. Sugar, as much as I would like to say sugar is not inflammatory, it totally is. It is absolutely 100% inflammatory. Sugar likes to jump onto proteins, so it binds with proteins, it glycosylates the proteins, and it then oxidizes them. And the oxidative process is, it's like the browning of the apple or the rusting of the old horseshoe. Then that's the inflammation stuff that comes, and it causes joint pains and muscle aches and all sorts of things. So that's sugar. We've got seed oils. Okay, so seed oils are things like, we call them vegetable oils, but they are inflammatory because they've got very high levels of omega-6. So there are 2 fatty acids that we can't make. We need them. We can't make them. So they're called essential, and it's sort of essential that we eat them. Well, that's great. We're meant to eat them in a ratio of about 1:1, and that's what we used to do. So omega-3 and omega-6 about 1:1. Then with the Industrial Revolution, we sort of increased our grains and things like that. So it started to be about 1:4. And we coped with that. Our body coped quite well with that. But now with the invention or the advent of processed foods, and depending on how much processed foods people consume, they're eating 30 to 60 times the amount of omega-6 than is helpful. So omega-6 is the pro-inflammatory fatty acid, and omega-3 is the anti-inflammatory fatty acid. And so it's so helpful that the supplement industry has come along with a solution for us and said, well, why don't we just all have fish oil or krill oil, because they're all omega-3, and that's all you need to do. Keep eating your processed rubbish and just take some fish oil, except that doesn't work. So the idea being then, if we reduce the omega-6, if we can, it is tricky because not everybody likes fish. Some people are allergic to seafoods, but you can certainly get your omega-3s through things like chia seeds, walnuts, some plant-based products that you can get them through. But even meat has omega-3 in it, and eggs. They're just not as high as fish. Oh, and third thing, sorry, I got carried away. I did the 3 things and only gave you 2. Third thing is highly refined carbohydrates. So the highly refined flours, wheat flour, rice flour, the chips, those sorts of highly refined things are the 3 inflammatory foods. So it's tricky because, I was talking to a lady today who was telling me how she has Special K for breakfast every morning, and she chooses the one that's low in sugar, or there's apparently a few varieties. It's been a long time since I picked up a packet of cereal, but she alternates between the low sugar and the high fiber one. And it's like, wow, again, people don't know, but that is a highly processed product full of garbage.
Yeah, just grabbing for a box of cereal. It's not what we imagine it to be, or what we've been told in the media, like, oh yeah, beautiful cereals for the kids. And it's actually, it's handy, but it's not really giving them anything, like nothing positive anyway. It's crazy.
No, Iron Man, Wheat Bix, what is it? Nutrigrain is Iron Man food. And I just think, think about that iron, all rusty and oxidized. Terrific.
How about we interview some Iron Men and see how many actually eat it?
Exactly. I know.
So when a patient comes into your clinic, if they have lipedema, how would you treat them differently? Is there anything you would do differently for that patient with lipedema?
Yeah. So I talk to them about the options. So, it's a bit like there's a 3-step process. I sort of say that, the first step is, if we're looking at food as the thing that we're going to focus on in that particular consultation, if we're making it about the food, the first step is to minimize processed foods. Like that, if you can do that, yay, good, tick. Then the next step is we discuss about a low carbohydrate approach. And then we also discuss about a ketogenic approach, because low carb and keto are slightly different and people need to make an informed decision. So, if there is some evidence for a ketogenic approach, in particular, because we know that ketone bodies, so the beta hydroxybutyrate, is anti-inflammatory. So it's like, right. So it's got an anti-inflammatory component to it. And we know, and there's well-documented evidence for pain management across multiple conditions. So not just lipedema, but back pain, joint pain, MS, chronic things that cause chronic pain. And so we go, right, well, they're your options. So, first rule, get rid of processed food. Second one, drop your carbs. Third one, think about a ketogenic diet, but only if, again, it has to work with the person. The woman has to want to know about it and want to do it, because there's no point me just foisting it upon them. That's not going to work. So it's always a collaborative decision. And then I always talk about testing your ketones as well. So the ketones are, you can sort of, you can tell if you're in ketosis if you've got a trained, basically, brain palate. But I always go, just test with blood. Don't bother with the urine strips. They're unhelpful. They're inaccurate. They just tell you how much ketones you're weaning out. That doesn't tell you anything. What we want is the blood ketones if we're doing this as a therapeutic approach. So this is not about a diet for short term. This is a therapy, and it's different. It's a different way to look at something. If you don't want to do it, that's okay. You don't have to. You can just do low carb, but you may not get all the benefits that you could get if you employ a therapeutic ketogenic approach.
Yeah, so that's like a whole mind shift, isn't it? It's like that mental shift, like this isn't a diet, this is therapeutic, this is going to heal you, this isn't some fad diet culture thing. This is actually a prescribed way of eating to reduce your inflammation and to start healing.
Yeah, absolutely. And I think you've just raised an important point about diet, diet culture and diet land, because I know women in the lipedema community, I mean, they've spent years, decades, all their life trying to lose weight and being told that they're not good enough because they're still fat, and you got legs like tree trunks, and this is ridiculous, and if only you ran a bit harder, or if only you tried harder in netball or whatever. And it's rubbish. It's absolute bullshit. But what we do know is that those thought processes, that thinking style, has been ingrained for decades, and it takes some time to undo it. It takes time to undo that perfectionism that we've been taught as dieters, the all or nothing approach, you're either on a diet or on a bender, all of those. It takes a little bit of time.
Yeah, and that's a healing journey in itself. So can
Totally.
ketosis be activated through any other means?
Look, there's some studies coming out about exogenous ketones. So exogenous means that you've eaten the ketones, you haven't made them. And look, there's plenty of current rubbish products out there at the moment promising the world, not necessarily delivering anything. But there is a study coming out that's with a highly purified ketone ester, so a ketone body, not an ester. So it's much more like our own ketones that we're making. But I would say to women with lipedema, if possible, make your own. Because ketones that you take or drink or add to a, gobbledygook, they're fuel. Okay, so it's basically like eating more fuel. And we often, if you're going to eat fuel, eat food, because then it comes with a whole heap of other stuff, vitamins, protein, minerals, all the things that are good for us. So eat food for your fuel rather than taking a ketone supplement.
And it's satiating too, and it's pleasurable. Like, you get all those bonuses with that. So does intermittent fasting help with ketosis?
Yeah, it can. And we have to be, one of the things that I'm really mindful about, and again, this is the lipedema community is overrepresented in eating disorders, and which is, again, just a result of years of dieting and being told, that your body's not right and you're not good enough. So for many women, they do have a history of disordered eating. And so I always have to be mindful with intermittent fasting that, again, it's a change in mindset. Intermittent fasting is not about starving yourself. It's about a therapeutic approach. And you're right, you will increase your ketone bodies by fasting. But there's a few nuances with it. And again, if you have insulin resistance as well as lipedema, then you need to really wait until your insulin levels are low enough so you can access your stored fuel. If you try too fast, so the fast and the furious usually fail. It's much better and gentler to do it slowly and intuitively and just wait for it to come. And then it's a powerful process.
I think that's the hardest thing, like just relearning and also slowing down, like especially like Tiana and I, we're like, let's go hard, let's do this. But we're both on this journey and learning that it's just slow and steady. Like it's progress over perfection. Let's just try one thing at a time, see if it works. If that's working, okay, now we can add something else. So yes, I think we've all been burnt and we are slowly learning.
Yeah, and it's understandable because, again, Dietland was always about, go hard or go home. Nothing tastes as good as skinny feels, all of that stuff that was just rubbish. It never taught us about how to nourish and nurture our beautiful bodies, how to look after them. None of that. It's just punish it. If you're eating something, run it off with if you've eaten a donut, go for a run. And it's like you don't need to earn your food. You deserve your food. You don't have to earn it by doing a gym workout, and you don't need to punish it if you've gone down a path that you weren't, you're not happy about. You don't need to punish your body by then flogging it at the gym to burn it off, because it doesn't work like that.
Yeah, that's absolutely right. So what I want to ask you now, how do we get lipedema out in the community? Like, how do we in the medical community, how can we get it out there and educate more doctors? Like, you were proactive, you found out about it, but how do we just as a community get doctors to listen?
Yeah, it can be trickier. Doctors listen. Some doctors are really closed. Okay, I'd love to say all doctors are loving and open, but they're not. So, and people that are closed and fixed, I mean, it doesn't matter whether they're doctors, accountants, or anybody. You cannot teach someone who's not willing to learn. But if there's doctors will also listen to other doctors. So, without blowing our own trumpet, I would always say, and we do have a lot of doctors listening to our podcast, so that can be a helpful way, at least a first step, because they will do that. In Facebook groups, I'm always popping in going, oh, has anyone considered that this person could have lipedema? And they're going, yeah. And so educating about that. But also, I think, just like there's the Lipedema Society pamphlet that's really helpful. I think it's an interesting, I don't know what you guys think. I mean, you're living with lipedema, but I wondered if that pamphlet for a new person, it can be pretty confronting, can't it?
Yeah, absolutely. Especially if you're going to a doctor who might not have ever heard of it before, and you're going in there saying, I think I have this thing, like the vulnerability that takes to say, oh, I think this is what I have. Do you agree? Like that's putting yourself out there. That is a big step.
Oh, absolutely.
Especially for women who have been told to diet and exercise more their entire lives. Now they've been handed almost a lifeline, possibly, to answer some questions for them. And yeah, that it takes bravery.
Yeah, it totally does. And I think, again, it's about finding a doctor that you have a good relationship with, who doesn't make you feel like shit, because if they do, then they're not the doctor for you. And it's worth noting that as you are allowed to change doctors, you do not have to stay with a doctor that's a dick. Go with a new one and just find someone who listens to you and will let you, will let you advocate for yourself and be open. And then, so many people have said to me, oh, I went back and I told my doctor and they were really great. It's like, wonderful, fantastic, yay.
Yeah, that is a win for sure. All right, we're going to start wrapping it up now. Dr. Lucy, where can our community find you?
So I run a business with my gorgeous friend, Dr. Mary, called Real Life Medicine. And it's called that because we're both pretty real and we're very just passionate about women and women's health, particularly women who have lived in bigger bodies, who've had that whole diet trauma business. And, it's a really, it's currently a very topical topic related recently. I think Taryn Brumfitt was in the news. And look, she was actually misquoted, which is, again, so cheeky of the newspaper. They just want clickbait. So she was quoted saying doctors shouldn't talk to patients about their weight. And that then caused the doctors to go, oh, well, we do need to talk about it sometimes, which I agree, we do. But it's all how you approach it. And it's always about a beautiful, compassionate, and coming from working out where has somebody come from. If you're living in a body that isn't what society has deemed as aesthetically perfect, well, one, who gives a shit? Because your body it's not an ornament. It's not there just to be, a clothes horse. It's a powerful vehicle that carries you around. But what we want to do is look after that vehicle as best that we can, so it can do all the things that we can. So that's a long way of saying Real Life Medicine is our business. All of our Instagram, Facebook, everything's Real Life Medicine, and our website sadly is not Real Life Medicine because that domain was stolen. It's RL Medicine, which is actually shorter anyway.
Well, we'll put all of that in the show notes. I'm sure we can have all the links and everything there. So thank you so much for joining us tonight, Dr. Lucy. It's been great having you here.
Oh, you're welcome. And, well done
you.
to you ladies too on bringing this up, because it is, the more people that talk about it, then it really will. It will permeate through the medical
effect.
Community. Indeed.
Yeah. All right. Have a lovely evening.
Thank you so much for your time.
You're welcome. Thank you. Bye. Now.
Thank you for listening to the Lipoedema podcast. Lipoedema and its symptoms vary from individual to individual. The opinions and advice voiced on this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema podcast. Until our next episode, bye for now.